What's up guys? I'm Dr. Chris with Barefoot Rehab and Adhesion Release Methods, and today you're gonna see a maintenance longevity treatment with my dear friend Laura, who's been having some herniated disc in her neck episodes, and we help her recover from that in this treatment. Enjoy. Laura is a 36-year-old woman who's been a patient since February of 2024, and she has hallmark multiple herniated discs in her neck. So listen to her symptoms and hopefully you can see yourself in this so you know what's actually going on, because a lot of people, when they feel this episodic type pain, they think it's just a muscle spasm. She had aching, burning, and tightness on the side of her neck, and it eventually started shooting down her back, down her scapula. It would worse with exercise, lifting objects, sleeping incorrectly, rotating her head both sides or backwards. That's a hallmark disc problem because the only tissue that would limit 3 different ranges of motion is your disc. At best, her pain would be 2 out of 10. She had an average 6 out of 10 pain every day, and at worst, 8 out of 10. She also told me that she gets episodes 2 times a month for 4 to 7 days where she just can't turn her head at all. This is a disc episode, and your disc is tearing from the inside. And every single time that you have a herniated disc episode in your neck, you are further degenerating and permanently damaging your joint in your neck. You want to spend as much time, energy, money, and all of your attention on focusing on this problem so that this episode doesn't happen again. And so Laura really understands this. She's had this pain for over 10 years. It was around 26 years old it started, and she didn't have any car accidents or trauma, but it's been getting worse ever since. So you're gonna see this treatment today with Laura. She's 50% better. This is better than she's ever been with our treatment. She's only gotten up to 40% relief. And you're gonna see how we take care of her and continue to work out the adhesions so that she doesn't get another disc episode in her neck.
I have severe neck pain. I have a lot going on in my neck. And over the past 10 years, I've just went to so many different doctors. And then I heard about this place and saw the wonderful results and just made the move, came on over. I would have pain in my neck. I would have the headaches. I had pains in my shoulders because the pain would just like refer to those places. So it was a lot going on. Yeah.
How do you think since the last treatment? I know last time we were here, you kind of felt like you regressed back to square one.
Yes, and since then I feel so much better.
Percentage better?
Like 50% better. The pain in my neck is pretty reduced. It's like at a 3 or a 4. And I'm really just feeling the pulling down my shoulder blade and like a little tension up here, but nothing like it was. So it's here.
This is the worst out of all of it.
Yep, right now.
On the shoulder blade.
Like the crease of the shoulder blade kind of there. Yep.
Okay.
Yep, and then just right up here, a little bit of tension. But this...
How tight is this right now? 0 to 10? Only when you look down.
Only when I look down, yep. Like a 5.
Not constant?
Nope, not constant.
How about if you look to the right? Is that pull in that spot right here? Or
to the right, like a slight bit, nothing terrible.
Like a 1?
Yep. And then to the left, I'm feeling nothing. Oh well, no, I lied. A little bit up here, but not down the back. Yep.
What do you feel here?
Just a little pull down this way, like a 2.
But it's different than this.
And when you do that, it also, there's like the slightest little like pinch down here.
When I took your chin in.
Yes.
Point this spot again?
I'm gonna go right down there.
A little lower from the main spot.
Yep.
So this is Laura's 17th visit. At visit 16, she went away for about a month or so. How do you feel after that?
Pulling.
Where is it? Same spot?
No, that is like all up top.
From here to here?
Yep.
That doesn't go like, that kind of goes like on the angle.
Yep.
How intense?
Like a 3 or a 4.
So she was gone for about a month. A little bit over a month, her symptoms reduced back. How long were you symptom free? For like 3 weeks, 2 weeks?
Yeah. Yep. And then was gone for a month, and it went right back to square one.
And then she called and came back, and after the first treatment, when she came back, she's back to 50% better.
Good.
So we're at we're at this pace of like finding out what's her capacity of load and how further can we push it. So that's where we're at right now. I just did UCF and CF, so this test was the upper cervical flexion test, and she felt pulling kind of around by the elevator scap area. And then when I did cervical flexion, because she said that's when she pulls the most when she's on her phone or looking at the computer, and that pulls from here to about over here on a diagonal, which is pretty cool. And it's about 4 out of 10 pulling.
And you're only feeling when you turn to the left now?
Yeah, on my neck.
Yeah.
And it's just like right up here and then a little bit down.
Okay. Is this the best that she's ever been, 50%?
I feel so good today.
Isn't that you recovered much faster than when we first started?
Yep. So
Yeah.
super sore the rest of Thursday and Friday. By Saturday. Yeah. But by Saturday it was like whole new world.
Great. I'm so glad.
Before this, the highest was 40%. So this is more than before.
That's great.
Yeah, thank you.
You're saying up here too?
Mm-hmm.
And this is when you turn to the left as well?
Yes.
What do those symptoms tell you, Chris?
This feels like levator scap, which is very common, and it's irritated. So it's contracted. It's like the biceps just making contraction all the time, so it's protecting her. So now I'm just gonna have to find out why it's overactive, or if it's just protective for that disc episode she just had, which it may be. Right now the spinal accessory nerve feels clean. So spinal accessory nerve comes out of the skull in a bunch of different levels, and it feels like it may be, and it runs down on top of levator scap. And I'm gonna use this Kung Fu grip to treat it. Turn your head to the left. Look, spinal accessory nerve levator scap at C2. Does that feel any different?
It feels much better.
Where, both spots, here and here, or just this spot?
This feels much better, and
You still feel down here?
like the littlest bit. But this is
Good. Louder flex towards you.
If I had to give you a Dundee, it'd be the whitest tennis shoes.
that is such an honor.
It's one of the episodes. That was C6 nerve root at posterior middle scalene, seated, 1 pass. So last time she was here, because she had this disc flare up and she was back to 0% relief, I did a bunch of her nerve roots. So down here, the nerve roots all come out and go this way underneath the clavicle, and I can move them down here. They're moving. My thumb is sinking in, and I could just, it's soft. But up here, she doesn't like it. Not so much. So I'm gonna treat this nerve, which is probably C4, like the anterior middle scalene, and then wedge my thumb right underneath it, and then it's gonna feel like I'm prying it off her neck, which doesn't feel great, at least while we're getting it done. Okay?
Yep.
But the cool thing is when you get a good pass, it's immediately softer. So it's softer down here, and now it's a little bit not softer up that way where it comes out. So I'm gonna try to get under there. Pineapple's a safe word. I'm on it. Oh boy. Breathe. Last one here, I promise. This is longus coli. It's like the psoas in the neck. So psoas is in the front of the spine down there, longus coli is in the front here, and it's just a very important stabilizer to keep the neck strong and not overload the disc. And then carotid artery runs right next to it. So carotid artery is like this, longus coli is like this. And so especially down low, usually the longus coli can get stuck to the carotid artery, and sometimes people could be dizzy or get faint especially with the treatment. So, but for her, she doesn't get that, but it does feel a little bit stuck together down there, and she doesn't like that either, which is usually a good sign.
What do you feel here?
I don't feel anything.
Okay.
Isn't that amazing?
If you want to learn more about chronic pain relief and adhesion release methods, hit the like, hit the subscribe, stay tuned every Tuesday and Friday for new videos coming right to you, and I can't wait to connect with you.